Hey there, this is Dr. Evan Osar, founder of Fitness Education Seminars, the movement-based solution to the healthcare crisis, and author of the Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Thank you so much for tuning into this webinar. If you were at the 2013 IYCA's East Coast Summit in Canton, Massachusetts this past weekend, thank you for allowing me to share with you on this all-important topic. And here's a webinar I promised you. If you weren't at the event, here's a webinar on my presentation, Assessments, Enhancing Your Assessment Skills to ensure that your youth athletes aren't slipping through the cracks. And if you're dealing with adult clients, please note that these same rules apply to these clients. Let's get started. With all the information on assessments out there, what can I add to this topic? Well, for starters, there are nearly 30 million children and adolescents participating in youth sports. 2 to 3 million children ages 5 to 14 receive medical treatment for sports injuries each year and account for 40% of all sports-related injuries treated in hospitals. 62% of these injuries are happening during practice. We need to help our youth athletes avoid these injuries. As a coach, as a fitness professional, as a healthcare provider, you can be the first line of defense in the prevention of many of these injuries. However, you have to acquire the skills or have someone on your staff who can properly assess these athletes so they not only can prevent any of these injuries, but simply so these athletes can reach their full potential and not be hampered by recurring or chronic injuries. That's where I can be of help to you as a coach, as a fitness professional, as a healthcare provider. I want to thank Pat, Nick, and the entire IYCA staff for taking the IYCA in a positive direction and making sure they bring quality information and support you in your role with your youth athletes. I want to add a special thanks to our close friend, Sarah Nylander, who is the very reason I am part of the IYCA in the first place. And most importantly, I want to thank you because, as I said during my presentation, I believe the 3 most important jobs in our society are number 1, parent, number 2, teacher, and number 3, fitness professional and coach. And for some kids, your job can sometimes be even more important than that of a parent and teacher because you may be the most influential person in a young athlete's life. So this presentation really goes out to each of you that selfishly gives and positively influences the lives of our youth. So there are 3 primary things I want you to get out of this presentation. 1, to understand the difference between screens and assessments and understand what information we are gaining from our assessments. 2, give you an example of what an assessment of a common movement pattern looks like and help you become more adept at assessing the squat pattern, for example, and what exactly you are evaluating for. 3, understand how to go about implementing an appropriate corrective exercise program for improving your youth athletes' postural and movement strategies based upon your assessment. While it is beyond the scope of this short webinar to teach you every single strategy there is to improving your youth athletes' patterns, if you keep an open mind, begin looking with a new awareness, and take advantage of the many free resources we have on our website at fitnesseducationseminars.com, you can develop a new skill set and the habits required to be even more effective as a coach and or fitness professional. So let's get started. What is an assessment? An assessment is a specific look at your athlete's ability to efficiently, and this is going to be a big word for us today, perform a task related to their functional goal. So what's a functional goal? It's what your athlete wants or needs to accomplish. It could be strength, speed, stability, endurance, flexibility, or a specific skill. What's the difference between a screen and an assessment? A screen, you're basically looking at, can your athlete do it or can your athlete not do it? So again, that's important if you're working with a large group of, or screening a large group of individuals or athletes, is that you need to get through them and just see, can they do it or can they not do it? However, this approach can allow very high level athletes or athletes with good motor control get through these screens because they have a good ability. That's what makes them a great athlete. An assessment, what we're really looking at is, can your athlete efficiently perform the task you're asking them to look at? And that's really the crux of what we're going to look at in this short webinar. Assessment. So what's the benefit of doing an assessment? It gives us a more true evaluation of our athlete's function. It also helps us locate the primary region of dysfunction, meaning is there back pain coming from their back or is it maybe coming from their thorax or from their hips or down at their foot? Is there a lack of ability to jump high? Is it because of a lack of ankle dorsiflexion? Is it a lack of glute strength? Is it a lack of coordination? So where is their limitation and or injury stemming from? The requirements of an assessment, however, is that you must have the time and the discipline to conduct a proper assessment and understand what you're learning from your assessment. And also it requires a unique skill set. And you'll begin to develop some of that skill set. You've already have some of it, but you'll develop it to a different level through some of these techniques I'll share with you in this webinar. So when do you assess? Well, there's 3 primary times you want to assess. Of course, if you have an injured athlete, you want to do a proper assessment. If your athlete or client has a decreased performance, meaning they're not living up to their full potential, you want to take a little closer look at why they're not able to achieve that level that you think they can or their coach thinks they can. And also risk analysis. You want to see, is this client or this athlete at a risk to have an injury down the road? So before we go further, we have to talk about effective versus efficient. Because a lot of people talk about doing the right things, but are they really doing the right things? And that's essentially what effective is doing the right things. When we talk about efficiency, or is this pattern efficient, or is the process efficient, what we're looking at is, are we doing things right? And that's what I want to share with you and help you get better at, is make sure that things that you're doing are as right as they possibly can for the group you're working with. Understanding that there's limitations if you're working with 30 or more athletes at one time. There's so much you can do in that big group setting. But again, remember that if your athletes are falling through the cracks, they may be the ones that get injured and or don't perform at a high level. And just to be able to have the ability to know when to take those clients aside and get them a full or proper assessment. Okay? So again, going back to effective versus efficient, this youth athlete on the left, he can be very effective in this posture and movement pattern that he's demonstrating. However, he's in a non-optimal alignment. Therefore, he's more likely going to get injured. He's more likely going to be less efficient in how he performs. This female athlete on the right, she is much more efficient. If you look, her shoulders are squared, her pelvis is squared, her thoracolpelvic canister, we'll talk more about that as we go along, is aligned, and she's got great hip centration, knee centration, lower ankle and foot centration as well. This is going to give her the efficiency to kick this ball and perform at a high level, likely and hopefully without being injured, or decrease the likelihood of her being injured. And that's what we're really talking about when we talk about assessments for screening. Is the client effective, or are they performing and doing their task in an efficient manner? Again, another example. My client here, a 12-year-old lacrosse player, he's effective at doing push-ups. And you can bang out 12 to 15 push-ups, no problem. But is that an efficient posture? Is he standing in an efficient posture here? Is he performing a push-up in an efficient posture? And you can see, obviously, the answer is no. He can't hold the scapula stable in a static position, and when he loads up, they become even more dysfunctional. So this athlete is at the risk of developing movement and overuse dysfunction. Again, on the other hand, here's my niece, and you look at her scapular stabilization, and that's what we want to see. We want to see the scapula comes down and around the thorax, that she maintains a nice thoracolpelvic canister, and she creates that nice long spine position. And she's 6 months. Hopefully, as she develops and gets older, she'll maintain this nice control. Again, the difference between effective, he can effectively do push-ups, but he's not being efficient, versus my little niece here, who's much more efficient in this pattern. Let's look at another example. 2 high-level tennis players, Rafael Nadal on the left and Roger Federer on the right. Again, if you talk to a young boy, you'd say, who would you more like to look like? And most young boys will say, hey, I'd like to look like Rafael Nadal. Much more muscular, much more developed, very powerful tennis player. And if you look at Roger Federer with his shirt off, well, he looks kind of like me. Just kind of a little thinner, nothing very impressive about his physique. But let's look a little bit further. Both these guys are effective, but is one more efficient than the other? Let's look at just one simple pattern of these high-level tennis players. Here's a forehand shot by both individuals. Which one looks more efficient? Both of them are effective. Which one is more efficient? And again, it should be obvious when you start to look at both these high-level athletes. Rafael Nadal, very little torso rotation at all, virtually no torso rotation, no pelvic rotation. His feet are pretty static. Roger Federer, unlike Nadal, has nice long spine, thoracic rotation, rotation through the hip, Pelvis rotates around that hip, and it creates centration of the hip, knee, ankle, and foot on that stabilization side. Rafael Nadal, both very high level athlete. Both these athletes are very high level. Nadal has many more injuries than Roger Federer. So again, when we start to think about effective versus efficient, we want to think about the longevity of our athletes. Are we trying to improve them just for a short time, or are we trying to create more efficient patterns so not only do they become a more efficient athlete, but we set them up with proper patterns that they can carry into their entire life. Because if we allow them to just be effective but use improper form, then we're going to set them up potentially for injury and or lifelong problems. And those are the clients that come to see me with low back pain at 40 years old and don't know why they have low back pain. But again, a lot of these patterns were developed when they were small and younger, both athletes and children. So here's a great problem that we have with inefficient patterns. And here's a client of mine, plays soccer one time a week, has never lifted weights, has chronic low back pain when he stands for a long period of time or when he walks. Not when he plays soccer, not when he sits. Why does he have pain when he stands or walks, but not when he sits or plays soccer? And why does a client who's never lifted weights in his life, why does he have such chronic and hypertrophied lumbar erectors? Well, let's look at his assessment and see what he actually does during an assessment. When he stands on one leg, look at what happens. You see that the huge myohypertonicity that occurs, the excessive lat activation on his right side. You see he actually pulls himself almost into the exact same posture that he stands in a static position. This is why my client here is having low back pain. He is using a high-level strategy, and what we mean by that is he's overusing muscles to perform a low-level task. So that's a bad match when you use a high-level strategy for a low-level task. And when we talk about low-level tasks, standing is a low-level task. Standing on one leg is a low-level task. Squatting is a low-level. Bodyweight squatting is a low-level task. The things that we should do with bodyweight very simply are relatively low-level tasks. And many of our clients, and especially our athletes, especially those young athletes that get real strong real fast and at a real young age, many of them are using high-level strategies. They're overusing or muscling their movement patterns versus using an efficient movement pattern. And this is where we get into a little bit of trouble in our industry when we start talking about strength. Is yes, strength is important, but it's important on top of fundamental proper movement and stabilization strategies, that they're using the appropriate strategy for the task at hand. This client is not using an appropriate strategy for the task of standing on one leg. And that's what's is happening to a lot of our athletes, in that they're breaking down because they're using high-level strategies, and over a period of time, this overcontraction of musculature starts to break our clients down and creates a lot of these overuse and compressive injuries that they're experiencing. So, important thing to note is inefficient postural and movement strategies is what is causing your athletes to not reach their full potential and eventually breaks them down. So our goal as coaches, as fitness professionals, as healthcare providers, is to help our clients establish more optimal strategies. Allow them to use the proper neuromotor programming for the task at hand. If they're doing a low-level task like lying on a table and lifting their leg, they should not have to use a lot of muscle activity. If they're doing a bodyweight squat as a warm-up, they should not have to use a lot of activity. But when we start to load them up, that's when we can start to see this layering on or this higher level strategy for that task. So make sure that the client is able to use different strategies and that are appropriate for the task that we're asking them to do. So what is the key to an effective assessment? Basically, we're looking for an optimal level of control. In other words, we're looking for efficiency. Are they using the right strategy for the task at hand? So how do you determine if your client or athlete's strategy is efficient? Well, when we're looking at optimal performance strategy, we're looking at three components. We're looking for alignment. Can they maintain alignment and centration, or the ability to control their joints? Can they breathe? Are they using an optimal breathing strategy for the task at hand? Or are they holding their breath? Or are they sucking their belly in and just breathing in their upper chest? And what level of control do they exert as they go through their pattern? And we'll look at the squat as an example of that. And the information we're looking at through the squat pattern is one, posture and alignment. So again, the squat is really just a movement of what our standing posture looks like. It's going to look at our core, hip, and lower extremity function. can you align your core, hip, lower, and extremity, and keep it aligned as you move down into the squat pattern? And then level of optimal control. Can they stabilize where they need to stabilize, and can they dissociate or move joints independently where they need to move? So let's take a look at the squat. Okay. A, alignment. So what we're looking at with alignment during the squat is we're really looking at the thoracolpelvic canister. And what we mean by the thoracolpelvic canister is the thorax, the rib cage and thoracic spine, and the lumbar spine, and the pelvis and hips. Are they stacked? Are they aligned like a canister? This does not mean that they never move apart, but through most fundamental movement patterns, are they optimally aligned like a canister? Is that thorax positioned over top the pelvis? And we'll look at how you assess for that in a minute. From the side, we want to see that the rib cage feeds down into the pelvis, meaning that the spine is nice and long and the thorax is lined and feeds down into the pelvis, again, making that canister both from the front, the back, and the side views. And is the thoracic and lumbar spines lined up appropriately in relationship to the head. The pelvis should also be in a neutral pelvis, or neutral position. So again, the pelvis is neutral when the ASIS, so this bone that we palpated during our class, is when this bone here, the sharpest bone in the front of your pelvis, is in line with the pubic symphysis. So what we want to think about with our athletes, we're not going to sit there and palpate our pubic symphysis on our clients, but you can have them palpate it on themselves. Find the belly button, slide down until you feel the bone, which is your pubic symphysis, and stick your finger on that pointy bone in the front of your pelvis. See if those two bones line up. If the ASIS is in front of the pubic symphysis, you're anterior tilted, and if the pubic symphysis is behind or in front of the ASIS, you're in a posterior pelvic tilt. We talked about how sitting and improper activation of the abdominal wall, like this athlete of mine, you can see she's sucking in the abdominal wall, which is pulling her into a posterior pelvic tilt. She's also over squeezing the gluteals, and she's got short hamstrings, so she's in a posterior pelvic tilt. She lives her life in this posture, hence the reason she has low back pain. Most of our clients and most of our athletes, especially our youth athletes, what do they do all day long? They sit. Most of our clients are stuck in a posterior pelvic tilt because they sit all day long. What you often see as an anterior pelvic tilt is really thoracolumbar hyperextension, and we'll see that in a minute. Neutral spine, when the pubic symphysis and ASIS are lined up, it's actually an anterior pelvic tilt. So an anterior pelvic tilt is actually a neutral pelvis position. Alignment of the spinal curves. We want to have curvatures of the spine. We want to have a cervical lordosis, or a forward curve in the cervical spine or the neck. We want to have a backwards curve in the mid spine and the thoracic spine, and another forward curve in the low back or the lumbar spine. So that's where the spine is neutral. That's where the spine can load up optimally and prevent overloading of the spinal structures and decrease stress on the spine and the rest of the body. The spine essentially works as a shock absorber for optimal loading in these curvatures. When we change these curvatures, when we teach our clients to lift their chest up, pull their shoulder blades down and back, hyperextend their low back, as my client here, this youth athlete is doing in this picture, her cervical spine straight, her upper thoracic spine straight, her thoracolumbar junction hyperextended. And this is how many of our clients are living in their bodies, especially our youth athletes that come in and we teach them how to lift that chest up and pull the shoulder blades down and back. We have to think of different cues to use, and we'll go over them, how to correct and improve posture and alignment without resorting to these cues of pulling your shoulder blades down and back and just squeezing and tucking under. Breathing, without going into a long dissertation about breathing, there's plenty of videos on our website at fitnesseducationseminars.com. Just make sure your client and athlete is breathing. They should be able to use 3 different regions of breathing. They should be able to breathe apically, or up into their upper chest and ribcage, laterally or wide into the ribcage, and abdominally. Again, we need breathing in all 3 areas, not just one, but all 3 areas. Make sure your client breathes well, because breathing sets up stabilization. That's why breathing is so important. When we breathe right, we can stabilize right. So that's why we have to focus on breathing in our clients and spend some time with them, teaching them how to breathe. Doesn't mean you spend a whole session, but you have to spend time with them, especially these clients and athletes that come to us and they're stressed out and they're holding their breath and they're in a sympathetic dominant system. Breathing gets us into the nervous system, makes us aware of our body, calms the nervous system down, and allows new programs to be put in. When you're sympathetic dominant, you can't put in and condition new things. The body is just in a defense mode. Get them breathing right, And now you can institute a new program, a new learning strategy into your youth athletes. Again, we should be able to use different breathing strategies based upon the task that we're doing. C, control. What we're really looking at is, can your athlete control their body both statically and dynamically? And what we're looking for is the ability to centrate their joints. And centration is just a fancy word that means neuromuscular ability to maintain an optimal axis of rotation. Can a client maintain optimal joint position during their movement? And we're going to be real general here. You don't have to get crazy and specific. We're going to be real general. Can your athlete line up their thoraco-pelvic canister? Can they keep that thorax position over top their pelvis? Can they keep their spinal curvatures? So what you're going to do is you're going to square yourself up behind your athlete, lightly palpate their lateral trunk. And again, make sure you explain everything you're doing with your client, especially if you're not used to touching your clients. Make sure you get permission. Make sure that if you are putting your hands on your clients, that they understand what you're doing and that you have another adult and or athletes around there, so you're never accused of doing anything inappropriate with your athletes. And again, if you're not able to put your hands on your athletes for whatever legal reasons, no problem. Then you have to be real good with your eyes and really look at your client, but be close to them so you can really observe what they're doing. So you want to square yourself to your client. If you're able to palpate them, laterally palpate the thoracic cage. Make sure it's stacked over top their pelvis. So when you look down, is their thorax lined over top their pelvis? And again, small changes in this thoracic position, small changes in pelvic position can make all the difference in how your clients perform. So don't say, oh, it's just a small little rotation, it doesn't mean anything. Those things can be huge on their performance. I've seen changes, dramatic changes in my athletes by changing, just making small changes in their thorax, and now they're able to access their core. Now they're able to access their glutes. Now they're able to rotate better from small, almost seemingly minute changes. So don't get hung up on saying they're little changes. That's not going to make a difference. Little changes are huge. It's like thinking about how much difference is there between the first and second place finalists in a sprint. Sometimes it's less than a second. Oftentimes it's less than a second. How many times, or how much distance is there between a made putt and missed putt? Sometimes it's centimeters, maybe millimeters. The shot is off. It makes all the difference. So start to look for and pick up these nuances in your athletes when you're assessing them. So during a dynamic assessment, your hips should remain centrated. So we don't want any of that over gripping of the hips that we notice in class. The trunk should remain aligned over top the pelvis. The pelvis should remain neutral. We talked about the slight anterior pelvic tilt is the neutral position of the pelvis. And the hip, knee, ankle, and foot remain aligned. And we should have a foot tripod during our squat and lower extremity patterns. So control, what we want to do is also we can look at spinal curvatures. As a client squats, how much activity are they getting through their erector? So again, you can palpate the erector tone, you can palpate their spinal curvatures if you're able to do that, or if you're not able to do that, then you gotta get real good at looking at it. And you follow the thorax through the motion. Look down at the pelvis. Does the pelvis stay square? You can have the clients palpate their own hips if you can't palpate them, and make sure they're not over gripping their hips. When you're doing a bodyweight squat, for example, during a warm-up or a lunge during a warm-up, you should not have a huge amount of tone in your hip flexors or even your glutes. And you shouldn't be over-squeezing just from simple patterns like a bodyweight squat and or lunge. So what we're really determining is the motion controlled and is the level of effort they're using appropriate for what you're asking them to do. So during a bodyweight squat, they don't need a high level of effort. You don't want a high level of effort. We want to teach them a low level of strategy so they can balance out their musculature, meaning they have to be able to use their muscles in a softer manner or a stabilization manner versus just using their muscles to contract really hard. Like I said, we need a different strategy for the different tasks and how we perform tasks. We can't be using the same level of effort for every single task throughout the day. That's really what's breaking our clients down, is when they don't have the options, they don't have an alternative strategy to use. They use the same strategy all the time. So the common errors of the squat pattern, what we're looking for is a lot of our clients are going to go into that thoracolumbar hyperextension. This will limit how much our clients can breathe, overstretch their abdominal wall, and really limit how much they are able to stabilize their thoracopelvic canister, which is leading to a lot of our clients' stabilization issues, low back pain, and hip dysfunction. We'll see lumbar flexion because the clients are starting to, they don't have enough hip mobility. They're over gripping their hips, so they can't maintain a neutral pelvis. They'll go into that posterior pelvic tilt, which drives lumbar spine flexion. We may see transverse plane motion of the thorax or pelvis, and this is when your client is squatting, and you may see rotation through the trunk or rotation through the pelvis. The thoracopelvic canister should remain aligned throughout the squat pattern, and of course, we'll also assess for breathing patterns. Are they holding their breath, or are they able to breathe appropriately through the pattern while maintaining nice alignment and nice control? So if we see a loss of thoracopelvic alignment, meaning you see hyperextension at the thoracolumbar junction, that area right below the rib cage, right before the lumbar spine that we saw in class and we've seen in a lot of our clients, that we saw in that youth athlete earlier in this presentation. Well, one of the biggest things you can do is teach them how to breathe right. Lay them on the back, raise your legs up so you're almost in a squat position on your back. Teach them how to breathe into their lower abdomen and into their low back. And again, you can have all your athletes doing this at one time in the beginning as part of your warm-up. And that's what we do in our group classes. Have the clients lie down, bring their legs up to a 90-90 position, have them activate their core and breathe into their lower abdomen and into their low back. So again, they start to get better alignment. When they stand up, I want them to relatively maintain that same alignment. So breathing is a powerful way to improve alignment and stop some of this over gripping we're seeing in our clients. If you're seeing some transverse or sagittal plane motion of the pelvis, meaning the pelvis is not staying neutral, not staying controlled, well, now we start to use cues to centrate the hips. Cues like relax the front of your hips, relax those hip flexors, have your client or athlete palpate the front of their hips so they're not over gripping through their hips during body weight squats, lunges, patterns like that. We did a webinar on hips and how to improve hip centration, so you can catch that on our website, fitnesseducationseminars.com, in the resource center of free videos and webinars. So again, improving the ability to centrate those hips and get the hips appropriately aligned within the acetabulums or the sockets goes a huge way to improving function during squat and all lower extremity patterns. So, conclusion. In this webinar, we discussed the importance of evaluation of your athletes and clients, and more importantly, how you can use your assessments, in this example, a squat, to assess your athletes and clients' ability to align and or centrate their joints, to assess their breathing and therefore stabilization strategy, and assess how they integrate alignment and breathing into a functional pattern, in this case, the squat. Through education gained by developing a new awareness, you can begin to pick up the nuances of improper alignment, breathing, and control during fundamental exercise patterns like the squat. And by improving your athlete's ability to perform these fundamental patterns, you empower them to reach their fullest potential while potentially reducing their risk of injury. And most importantly, when you serve with humility, confidence, and integrity, you move from being successful, where you acquire things like fame, money, and material objects, to being significant. That is, where you're leaving your mark on this world. As my favorite poet, Ralph Waldo Emerson, said in the last line of his famous poem, Success, and I know he was really talking about significance, to know even one life has breathed easier because you have lived, that is success. Keep doing what you're doing because you are changing the world. If you are looking for additional resources to help you serve those clients you are meant to serve, check out our website, fitnesseducationseminars.com. While the website was primarily designed as a resource for those of you who work with the general population, because our integrative movement system was designed based upon the principles of human movement. The principles are respiration, centration, and integration. They are 100% applicable to athletes and high-level individuals. We have over 100 free videos on a variety of topics, including assessment, breathing, corrective exercise, developing and expanding your knowledge and skill so you become the expert your clients need, want, and will pay for. Sign up for our bi-monthly newsletter, Fitness Insider, as we are constantly sending you the most up-to-date information so that we can support you in your quest to serve those individuals you are meant to serve. I want to thank you so much for watching this webinar and hope that it has helped you remain informed so that you can become the expert your athletes and clients need and want. If you like this webinar and feel that it can be of help to others, please feel free to like it and pass it on to your friends and colleagues. This is Dr. Evan Osar of Fitness Education Seminars, providing you the solutions and strategies you need to help your athletes and clients perform at their highest level. Take care.